Hi, everyone. Michelle with ASIS Massage Education here again, joining you for another Friday live stream with very special guests. Today's guest is none other than Whitney Lowe, who's been an educator in the field for over 30 years. We'll find out a little bit more of how he got to that point. Many people know him for his orthopedic massage training program and all that he's contributed to the massage field, not only with the education, but advocacy. And I asked him to be a part of today's conversation because he wrote an article in the latest Massage and Bodywork magazine for ABMP called The Future of Advanced Credentialing in Massage. And I was telling him a little bit. We'll talk about it, why I thought it was a great topic. And I know there's a lot of questions that come up here in our entry-level program, but just a lot of confusion around what these credentialing means and certificates and all the terms that were kind of thrown around in the field. So let's see if he can solve all our problems and explain it all to us here. So let's bring him on and say hello. Hello.
How's it going?
It's going well. Yay.
Right. Confetti shower.
Yes. I got to give you some love there. So
all right. I'll take it.
So we were just briefly talking before we went live a little bit about why I wanted to talk about this. But if you don't mind, for especially some of our viewers who might not know a lot about who you are and what you've done. I know I was saying that I've been following you for a very long time, all my field of my career here. And we have some longtime instructors here that heard your name and like, oh, I love Whitney Lowe.
Right.
So would you mind sharing a little bit how you got into the field and how you kind of progressed to where you are now in the field?
Yeah, absolutely. So I've been doing massage in the massage world, let's see, counting, I think it's 34 years now, something like that. The years move a lot faster these days.
Yeah.
So I like lose track of them, but late 80s, let's put it that way. It was the late 80s when I got into this. So I was originally in graduate school studying psychology and got interested in massage. So looking at the sort of mind-body connection and a lot of the things that were going on in the sort of alternative health community at that time. And I was planning to be a counselor and thought that, if I was getting kind of burned out in my graduate school program, and my former wife was going to massage school, and she was telling me about all this cool stuff they were learning in massage school about, client therapist relationships and all this kind of stuff. And I'm like, this is what I'm, going to graduate school in psychology to learn all about. And they're studying this in massage school. This is really fascinating. And so I decided I want to take a break from graduate school and go to massage school and learn more about the body. And then I would go back and finish my master's degree later on. Right. And like so many people, I went to massage school and I got hooked. And there was no leaving at that point. It was just like, there's so many things happening in this field and it's so diverse and incredible. Right. I was planning to be just like a 6 or 8 month break from graduate school, and it turned into 34 years now. So.
It hooks us back in somehow. Like
it does. It does. And, interestingly, I actually went back to graduate school several years later, again, in a different field to study sports medicine and biomechanics.
Nice.
And then that master's degree program got interrupted by another great learning opportunity that came up for me in massage to do an internship and sort of a private mentorship with Benny Vaughn, who's a outstanding educator and leader in the massage field. And I just thought, I'm never going to get this kind of opportunity again. And I thought, well, I'll just, as soon as I get through with this project with Benny, then I'll go back and finish my master's degree. And then I ended up moving I was in Atlanta, Georgia at that time. I ended up moving out of Atlanta, moving out here to the West Coast shortly after that. And so again, two halfway completed master's degrees that don't mean anything on paper. So
well, together,
that's kind of interesting with our topic today about credentialing and all that kind of stuff. So it does come up, a number of different times. But a number of years after that, I got really interested in the medical applications of massage, especially treating pain and injury conditions. I had a wonderful, fortunate opportunity to work with an orthopedic clinic that was affiliated with Emory University's medical school back in Atlanta. Nice. And we just did all kinds of really interesting things with massage. And we're using kind of massage in that environment as sort of an experiment for a lot of the practitioners there. It's like, well, they would ask me, hey, do you think massage could help with this? And I was like, I don't know. Let's see. And
let's try.
We'd try all kinds of stuff. And sometimes it was really great results and sometimes it didn't do anything. And but the wonderful thing about that environment was that it was a teaching clinic for a lot of the medical students. So there was a big focus on education. And also it was an interdisciplinary clinic. So we had physical therapists and athletic trainers and occupational therapists and orthopedic surgeons and sports medicine
Wow.
specialists. And so
That's amazing.
I know I was really probably a pain to them, because I would just, as soon as if I didn't have a client on my schedule for that half hour, I was just following everybody around. What are you
Yeah.
doing? What are you doing? Why are you doing that? Why are you doing that? And I just wanted to take that opportunity to learn as much as I could
Wow.
about how to use massage for that kind of thing. And so that really led to eventually a lot of the producing of educational materials, because I was teaching in massage school at that time. And just, this was like late 80s, early 90s. We just didn't have many resources for massage schools.
No, yeah.
So that kind of led to me creating and developing the educational company that I'm running now to produce educational materials for massage therapists, mainly around treating pain and injury conditions. So that's in a nutshell what the whole backstory is about.
I know it's such a trailblazer for us now, who are like looking at in massage therapy education, that we get to just purchase a textbook, and all of you that have come before, and put that all together. Even I know when I went to school, I'm only 20 years in the field now. I feel like I'm a baby compared to some people, but even back then there wasn't a lot, and the schools are coming up with their own manuals and things, and so being able to learn from everybody, and how you learn by learning from other people, and putting everything together and making sense of it all, for those of us who are like, what is going on in the body again? So
there's a lot of rudimentary processes that we went through. I'll tell you a funny story. A teaching colleague of mine and I were teaching a workshop, and this was, I'm going to guess, like maybe 1993 or something like that, maybe 92. And we were traveling somewhere at a hotel, and we were trying to figure out how to make an audio visual aid to do a tracing of this thing. And Rick said, we were in this hotel room, and goes, "Oh, hey, wait, I got a great idea." And there was this clear plastic deflector on the air conditioning vent. And he pulled this plastic reflector off of there and laid it on this piece of paper and put the tracing thing on it, and then took a lamp off the end table and stuck it underneath it to make a light box. It's like,
oh my gosh,
that was really revolutionary, stuff at that time. It's like, and there was, the early training manuals were the ones with, photographs that were scotch taped to a piece of paper and run through a copy machine. So, that was the early days of our desktop publishing processes. So it's come a long way since then in educational materials, for sure.
I know. To see everyone's like edition 7s and everything coming out, it's pretty amazing. Yeah. That's so cool. And I still love, and one of the things that I really loved about following your work and stuff is that you never stop learning. You've said it yourself, right? You have all these degrees you could go on, and you're like, I'm in this field, but I'm still learning about things that we thought was always one way, and now it's perhaps we need to question that. I loved your conversation about using assessments, and you're like, I kind of have a book about it, but maybe we need to kind of start rethinking how we're applying that into entry-level education. And it brought up a really great conversation here among our staff members. So that was it's great to see that there's never a stopping point. We still have a lot to learn.
It's challenging because especially, and I see this among a number of the other sort of prominent CE educators and educators in our field that have been out for a long number of years, and maybe they're whole teaching method or methodology is based on a certain theoretical model that they were taught when they were younger. And as new research has come out, it's kind of shown, well, this isn't really how it works. And you've built a business around this whole idea. So it can be very challenging for certain individuals. There's some, can't remember the exact quote, but it's something about, it's hard to get somebody to change their perspective about something if their business depends on them not understanding it, so for that reason, and those of us who've produced videos, books, other kinds of educational materials, and then it's out there in print, and then something changes and it's wrong now, that's a challenging one to go back and say, well, I wrote that, but it's no longer accurate. And so you have to have a certain degree of humility to be okay with knowing that at a certain point you're going to be wrong about things. There was a quote from a really good physician educator too. He said something about this was a talk to a bunch of medical students. It said something like 3/4 of what you learn in medical school is going to be either wrong or out of date in 5 years. The problem is we don't know which 3/4 that is. So you just have to be okay knowing that things are going to change.
Yeah, so much information out there, and I love that you're talking about the humility, because I think that wraps into what I wanted to also bring up when we start talking about the credentialing process. Is I think there's a little bit of egos associated with some of the certificates and things
A
that are
little
out
bit,
there. Yeah.
right? Yeah, there's some of that.
Yeah, I know. So, yeah, so why I wanted to talk to you is because students will say, especially some of our students who, like, from day one, they're like, I've heard all this stuff about this and I want to learn that, and once I get through here, I want to go through here. So what do I do next? They're always like, I
Yeah.
know there's more to do. What do I do next? And it's of course not a one size fits all option for anybody, because it depends on who you want to work with and what you're
Yeah.
going to do. But the topic always comes up about, well, I see there's this such and such certificate program, and I can get the certification program, and I can become a certified, I'm not going to mention any certain things, but certified blah 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 therapist, right? And they said, shouldn't I have those credentials under my name, or after my name? And I've had people contact us and say, I need to be certified in prenatal massage or whatever it is. Do you have those classes? And we have to explain, we teach those and we have continuing education in them, but having classes in them and doing a certification are two different things.
Yeah.
And really in the massage field, and you can let me know if you agree with this and what you see, there's very few certifications. Like there's really not a lot, because certification needs to have an accrediting body. There has to be a little bit more of like checks and balances. So in like a mini nutshell, like can you describe a little bit what the words and how they get a little confusing with
Yeah,
those?
some people, let me just say this. First of all, a lot of people really get lost in those terms because they don't understand those distinctions. And a lot of people also don't understand why those distinctions are important. And I do think they are very important. Mainly, I'm talking here about the distinctions between certification and certificate programs.
Yeah.
Because there's a lot of, especially in the CE world, there's a lot of continuing education programs that are labeled and named as certification programs, and they're not. And here's where the difference lies. A certification program, as you mentioned, and really there's only like maybe one or two true certification programs in our field. The big main one is the National Certification Board's board certification program. And I do think there's another one from, I can't remember now. There's maybe one or two. But the key thing with a certification program is it is training program agnostic, which means it doesn't matter what training program you've gone to. If you meet the criteria for the certification program and you pass their credentialing, rule, whatever it is, an exam or whatever it is, the methodology is usually an exam. But if you meet their qualifications and you pass that exam, you can be eligible for that certification. Now, that's done usually by some type of third-party entity that is trying to validate that you've met a certain specific group of knowledge, skills, and abilities in a particular field. And that's been defined by usually surveying the profession and finding out what are the key things that somebody needs to know if they learn this particular skill. What we see a lot more of are things that are often labeled as certification programs, but they're really a certificate program. And what that means is, I'm just going to make this up. I got a program in rubber ducky massage. Okay.
Yeah.
And I want to offer a certification in rubber ducky massage. So I'm going to say to everybody, hey, you can go through my program and you can get certified in rubber ducky massage. But actually, that's not really a certification program, because you have to go through my rubber ducky massage program to be eligible to get that, what we're calling a certification. And that actually is a certificate program, because what it means is it's really based on that particular training program. You can't just go sit for the rubber ducky exam. You have to go through the training program that we've offered to get you there.
Right.
So that really is a certificate program, and a certificate program is specific to one particular credentialing organization or individual or something like that. And so why that's important is that there's more weight oftentimes given to a true certification program that is not dependent on one person or one organization's sort of company and their delivery of that particular credentialing process. And there's usually more strict requirements. And usually with a certification program, there's requirements for continuing education to be met. After a certain number of years, you got to keep your certification current by doing additional things like that. There's a number of other fine points around that. But the key thing is to understand that distinction between a program that's based on you finishing a training program with a particular individual or a company, or a university, for example. Universities do certificate programs all the time in particular areas. That's going to be a certificate program, as opposed to something where it doesn't matter as much where you got your training, as long as you can show that you met those key skills of knowledge, skills, and abilities that they've designated.
Yeah, absolutely. And that's great points that you bring up, because I'm thinking of ones, and we're not saying, also for anyone thinking, maybe say, well, I shouldn't take any certificate program. No, we're not saying that they're not good education, but it's, you could definitely learn things from it. But the point that you bring up, that somebody else isn't evaluating what you learned and how well you've retained the information, and making it like a third party, unbiased. I love the term agnostic learning as well. Because it's just like, okay, you passed these things in my class, so yeah, you're good to go. But maybe you didn't learn. Maybe I'm not good at teaching you about carpal tunnel syndrome or something, so you have no clue what that is. And now I'm telling you, you're a certified medical massage practitioner or something like that. But someone else may think that's more important. Yeah. So
and you bring up a really good point there, Michelle, because a lot of people use the certification as some kind of indicator that you have more specialized training, and you most likely do, even if you went to a certificate program. But because the public also doesn't understand that distinction, they'll view something as a certification program as meaning a lot more. And just remember, with each certificate program, it really is only as good as the organization that has created it and the educational program that they have created to get there.
Yeah, absolutely. Yeah. And I've seen, like, one of the ones I'm really into prenatal work, pre and postnatal work. And, I see people offering it all the time, and the level and the differences of what they offer, they're night and day sometimes. But the only commonality is that there's a pregnant person involved. That's so how much somebody focuses on the anatomy and physiology going on, or the techniques, or how many times you have to work on someone and pass off and take a test. Like, it's all over the place. There's no commonality within it. So that I think lies a challenge for some of us in the field, where it might be just who's got a better marketing set point to decide who's gonna take my class or not.
Yeah, that's really true. That is also one of the things that's gotten me very interested in watching this trend that began developing. Let's see, when is it? Maybe, I don't know when this actually started, probably around the 2010s or something like that, of something called digital badges, which is, when you complete a particular training program, and let's say you put this on your LinkedIn profile or something like that. I completed, let's go back to the rubber ducky massage. I completed the rubber ducky massage training program with the Academy of Clinical Massage. An individual can go click on that link on your LinkedIn profile and see the curriculum of the program that you did. They may even also be able to see examples of your work in that program, if that's also part of your profile. So there's a lot of new and interesting ways that companies are looking at credentialing issues and being able to show what is the value and the meat, essentially, of that credentialing program.
Right. Yeah. And so I think one of the issues that we run into here and within our field is that we as an industry can't decide on a commonality, I think, or what's the definition of pretty much anything. Right. And I love in your article, you're talking about two types of massage, and not saying that one that works more in the spa field isn't therapeutic, because we get that, but we need, for definition's sakes, to kind of define certain things, because is there a way that we need to define at this level of training, you get a certain type of credentialing, and then you get advanced training, but what is advanced training? And I don't think, I see people kind of not infighting, because they're not like angry about it, but I don't see any point of conclusion for anybody. They're still I still do this and I still treat that, and you don't do this and I don't do that. And
with the CE educators, it's when you start talking about trying to establish standards, it's like, well, I want my program to be part of this thing, and I want my program to be part of this thing. And it makes it really challenging for us to establish comprehensive standards or competencies around that. But there's certainly models out there for especially the movement that's called competency-based education or mastery learning, which has a lot of potential methods or means by which we might eventually get there if we can ever agree to come to the table and start talking about these things. And part of the issues here, and I don't think I delved into it in the article very much, but part of this goes back to some real fundamental facets of the fact that we aren't truly an academic field. We are a lot closer to a trade school and a sort of a legacy model of training that goes back to the sort of guru mentor and an apprenticeship kind of models. When there's a teacher, there was a sole teacher, and they taught their students, and those students taught those future students, but all came back to that one individual guru or leadership person. And so everybody refers back to, well, this is the way that Bob taught it when he invented this thing. And so that's the authority, is Bob. Whereas in a traditional academic model, like in a physical therapy program or a nursing program or something like that, there is no Bob at the top. There is, does this fit with the existing research base and the evidence that's out there?
Right.
And so we have still yet to move out of that kind of legacy model of education into something that's a more academic type of structure where we can have a greater degree of credibility to those kind of things. Now, I'll also say this, that I've been really pleased to watch over the last 10, 15 years, a lot more people coming into our field questioning authority and doing these kinds of things and saying, like, wait a minute, so-and-so is saying this, but that does not fit with what we understand about current evidence. And we need a lot more of that. And we've begun to see more people getting some academic chops of being able to have constructive academic debate and critique things and say, like, and people need to understand that there's absolutely nothing wrong with academic debate. That's how you develop.
Right.
That's what makes you a richer, more comprehensive, good analysis field. That doesn't mean that it's just free reign on, Facebook trashing people, which tends to be what a lot of these things devolve into, on social media sometimes. But academic debate is an absolute essential part of growth of any field. And hopefully we can see some more mature academic debate come along in our field in the years to come.
Yeah, I think that's really important. And to mention too that we're kind of babies in the research field. I feel like it's only been that I've known. I remember when I went to school, I just was looking up things, trying to find stuff, and I only found like Tiffany Field's work in the Institute, Miami Institute, the Touch Institute, and now it's, I don't want to say booming exactly, but anything you looked up massage related was how PTs were using massage techniques, and not quite massage. So part of that. Our responsibility now is to say, hey, this is all what we've been taught, but now we've got some things behind us, like the Massage Therapy Foundation, and people are starting to pay attention to us a little bit more. Should we start questioning just how much fluid are we actually pushing? And like all those things that we're just taught, like, the blood's flowing here and we're doing this. Like, are we though? Do we have proof of it, or did we just like kind of think it sort of worked that way?
So and you bring up a really interesting point too there, because until we have that increasing degree of academic precision and the ability to critique things, we can't read those research studies and understand the methodological flaws in them. And so you see a headline that says, for example, massage doesn't increase circulation, because somebody did a research study and found that they did massage and they were measuring the mean blood volume flow through large arteries. And it's like, well, it just doesn't do that. But does that mean that massage doesn't increase capillary perfusion in the skin when you rub somebody's skin? I think you could make a pretty good argument for looking at that way, that is happening. So you have to be careful when you interpret some of the things that are in research studies, because the methodology of what they're actually saying might be a little bit different than what you're interpreting out of there.
Right. Yeah, that's really great. And I love how, we follow the ELAP, the, entry level analysis project, and we're CompTIA certified, accredited. So we're following their competencies and things, and how just from the last few years that I've been working in this field as this side of the table, seeing how much they're putting more into research, and it's it's part of the core curriculum. We use Susan Salvo's massage therapy book. There's 2 whole chapters on it. I mean, that's a pretty big deal. So I'm happy that we're hopefully getting more on board with it to be able to increase the I guess, how we look in the medical community more
Yeah,
than
exactly.
anything. And
Yeah.
yeah, to
Well,
be
I'd say two things. Number one, kudos to you and your organization, your curriculum development for doing that. And number two, to your students. You may not want to hear it as much, but question your teachers,
yes.
question those things, because that's how you develop those critical thinking skills, is really
Mm-hmm.
to question those things, and don't
Right.
just, take things as blanket statements, but ask them. And this is something it's especially a lot in the continuing education world. I've seen a lot of CE teachers be really uncomfortable when people question them about things, and they don't let people do that. And
Yeah.
that's one of the things that I always tell people the very first day, the very first thing when we get started: question me. You better ask questions, because I want to teach you how to think critically and go through good clinical reasoning. And this is the playing field to learn how to do that really well.
Yeah, I love that. And I hope we instill that in our students a bit too, and how we don't, like, sometimes, like, just give me a piece of paper that gives me the routine of how to do this. I said, I can't make that. I can't do that. That would be a huge disservice to you, because what happens when someone walks in and they don't fit that cookie cutter mold? You don't know what to do.
Exactly.
So they get a little frustrated sometimes. And I'm like, I promise you, it's for your own good.
Exactly. Yeah. We often speak about the clinical environment being messy. And what we essentially mean by that is that we learn a lot of basic foundational skills in the initial training, but when you get into real life, those things don't necessarily act that way. And you look at this just like an artist or a writer or somebody does. They have to learn basic grammar and punctuation, things like that. The musician has to go learn to play their scales, but that's not what gets performed on stage, and that's not what gets published in your poetry and your literature and all that kind of stuff. It's artistry by taking those things and doing different things with them, and recognizing, I got to look at this in an alternative way, because this is not at all acting like what I learned about.
Right.
And if you get locked into that black and white kind of blinders on process of it's got to look this way because that's the way it says it in the textbook, then you will be sunk in a clinical environment.
Yes, absolutely.
And that's why, clinical reasoning and critical thinking are so very important.
Yes. And I think this is a great segue to this. So we just got a comment on our Facebook. Will medical massage be a part of our ASIS curriculum? And thank you, Camille, for bringing that up, because I kind of want to address that, because it's kind of going into what we're talking about here, in that we don't have a class called medical massage here. We do have a class called injury rehab, and we do have other modalities where we address certain pathologies and show the tools that they're already using, even right out of Swedish, you can already use to address X, Y, or Z condition. And that's, again, going to our clinical reasoning, and that we're very focused on the kinesiology and how the body's moving and what happens in anatomy when you have a dysfunction and why it's not working correctly, and how you can put all that together in a little package and address that for that particular client, and hopefully make them feel a little better based on if they have piriformis syndrome or some carpal tunnel issues, or just soreness or whatever it is. And so I'd like to say we have medical massage, but I think the term too sometimes gets tossed around, that it has to be the only thing that somebody's going to learn to be able to treat certain conditions. And so I know your academy is a clinical academy, right? So do you find that kind of interchangeable, the terms like medical, clinical?
Well, I'm really glad that she brought that up, because that's a thing that people are going to run into a lot once they get out of school. They may hear this a good bit while in school even. The term medical massage is really extremely ambiguous, ill-defined, and doesn't mean anything, basically, because it is so broad. So, for example, our focus, my company is called the Academy of Clinical Massage, and our focus here is predominantly on orthopedic type of injuries. So massage for pain and injury conditions that affect people's ability to move. So you could certainly consider that, a medically oriented approach. But so is my colleague who works in a hospital with cancer patients doing something that's medically related or medically oriented. So is your prenatal work in many of those instances also doing that same type of thing. But the type of work that we do and the things that we need to learn about to do those kinds of work, very different. Okay, the cancer patient that is in, late stage cancer and getting chemotherapy has very different, contraindications, indications for treatment, or things that we would focus on than does the athletic individual who's suffered an ankle sprain who comes into massage for trying to get back to activity and make that competition in 2 weeks.
Right.
Both of them are medically oriented, but I would not consider that there's one body of knowledge that we would call medical massage that would be applicable to those two different types of environments.
Right.
So my encouragement to everybody is stay away from that term medical massage, because it's really ambiguous and doesn't mean much. And just to give you, some more elaboration on that, there's also a pretty significant movement of people out there who use the term medical massage to mean massage that's done under a doctor's prescription. And that could be anything. It could be all kinds of things. And in that instance, it doesn't make, you're saying that this is not telling you that it's a certain type of massage. It's telling you, how did that client get to you? The client got to you from a doctor's prescription, not that it has a particular type of work that's being done. Yeah. And, a lot of other people use the term to be related to, massage done for health insurance reimbursement. So again, now the term means who's paying for it. It's medical massage because the health insurance is paying for it. So again, so much ambiguity around that particular term.
Yeah.
And so really, I'm glad you brought that up, because it's something people need to understand, some of those distinctions, so they can say, like, well, what is it really about? What is this actually really about?
Yeah. I think most of the people that I meet, they usually are talking about injury related massage rehab. But you bring up the other parts of the conversation. You're like, well, we have a sister school, the Academy of Lymphatic Studies, where we have the Voder technique, manual lymphatic drainage, 40-hour course that we do. And people who take that class are then able to work with helping someone who's recovering from a rotator cuff surgery and kind of help, clear out the fluid in the area and things. So that could be a medical massage kind of situation. Yep. So it brings a great point that it's just such a loaded term. And I see a lot of debate too on the interwebs, if you will, about, well, who's really a medical massage therapist, and should I have these credentials? And again, so now we're coming to the credentials. So is there a medical massage certification?
No, there isn't. Yeah. There are individuals that will advertise that they have such a thing, but there isn't such a thing. There is no true certification in anything called medical massage or anything like that. So it's most likely marketing that's driving those discussions or those examples when you hear that kind of stuff out there. There is no medical massage certification.
Yeah. It doesn't mean their course isn't amazing and you learn wonderful things. But it's, anyone can put letters after their names too. And if you're not understanding the work, you're not because that's where I get with the ego we talked about earlier. That's where I get the ego things that happens. Like, well, I have these initials after my name, so I'm better than you as a therapist who doesn't.
Yeah. And
it's like, no, but I've got a really cool technique that helps everybody that comes in with their piriformis syndrome. And, I get a lot of recurring clients because of that. And, so, are we going to fight about it? Who's the better therapist?
And again, just to understand that whole issue around credentialing and letters, usually in most instances, letters are reserved for academic degrees, true certification programs. Like, for example, in the athletic training world, the ATC designation, Athletic Trainer Certified, is what that stands for. That's a designation from a third-party credentialing organization, and also state licensure. Most states, that use the LMT designation, licensed massage therapist. Those are accepted letter designations. If you come to my organization, you go through a training program and then you put RDM after your name, which is, rubber ducky massage. Okay. Because I gave you a certification in rubber ducky massage, that's not really recognized and it doesn't mean anything. So it is my wish that people would stop doing that, but I'm not going to.
I know. It's like, you could still have a great program. Just call it something else. It's 30 hours in learning all these wonderful things.
Yeah. Just say we provide a certificate program in rubber ducky massage, and it's the best in the country, and I'm okay with people saying that kind of stuff to explain why it is, etc. So, yeah.
I think someone should run with that and put some kind of logo
they will.
Together with it.
Yeah, they will. Yeah. I was joking with people years ago. I used to live up in Alaska, and I was saying that I was going to invent this new glacier stone massage class that was only going to happen with these specific glacier stones. And the key thing was that because the glaciers were melting, it was going to be gone in a few years, so that was going to make it, highly valuable and highly necessary for everybody to finish this.
That's the way you sell it.
That's
Act
right.
now
That's
before it's gone.
Yeah.
Yes. I have like a sad polar bear there.
Yeah.
That'd be the logo. That's so sad. So what if somebody wants to say, but I worked really hard and I still want to learn more and I want people to know I have these credentials. So is that where our board certification comes in with our NCB?
Yeah, I mean, it could be that, the national board certification has not really lived up to its original intent, unfortunately. I would like to think that we would get that way, to get to that place, and like that we're moving in that direction, possibly, but there's a lot of obstacles to that really being seen as and accepted as a good indication of a higher credentialing level. Now, granted, because I was working on the last round of the exam development for the board certification exam, it's gotten a lot better than it was. And it is a lot more challenging than it was. And it is going back to sort of designating a higher level of knowledge, skills, and abilities for individuals. So to me, it's certainly moving in that direction, but I don't think we're there yet at all in terms of that really being a strong indicator of a person having more advanced skills and abilities. The reality is what really says more about that is your resume of explaining what training programs you've done, what you learned in those programs, and how that's impacted or affected your work. And unfortunately, that doesn't boil down into a couple of letters after your name.
Right.
But there's that old joke too about what do you call the person who graduates last in their class from the worst medical school in the country?
Doctor.
Doctor, right? So, there's just because you have those credentials or that designation doesn't necessarily mean that you're skilled in those kinds of things. And that's where things like, your social media profile, the things that you put on your website promoting yourself, and I tell, this is a great thing just from a business perspective, I think. And it's amazing to me that I don't see more massage therapists doing this, but massage is such a personal, intimate connection with the individual who you're going to be in that treatment room with.
Right.
Put a video on your website and talk to people, talk to the camera, tell them who you are, tell them what you've learned, tell them what you're doing, because, until that point, you're a name and a mystery person that they don't really know. And when they connect with your personality and get to see about who you are, and you can explain some things, put some, anatomical things on there, tell them, oh, like, this is why I like to work with injuries. I like to work with runners, or, you're doing spa oriented massage. Like, here's why I give you the best, most relaxing experience you'll ever have in your life. And whatever it is that your specialty is.
Yeah.
Make that connection directly and personally with people. And I think that can oftentimes speak a lot louder than some of the credentials that people might try to put a whole lot of emphasis in.
Yeah, I like that, because a lot of times too, people, I've heard this as a deterrent to be board certified, is that people don't even know what those letters mean after my name.
Yeah.
And so they might think it sounds good, but really, I don't. As a person just down the street, I don't know what NCB means. And
I hear that argument all the time, and there's a lot of validity to that argument because, again, the general public doesn't know this. But I will tell you this also, that I think this is something that is significantly understated, which is when that client comes into your office and they're looking around, and on the wall they see this certificate from the National Certification Board that says board certified in therapeutic massage. There is an unspoken degree of or thought that goes through that individual's mind. Oh, hey, this person's board certified. And that can influence the client's perceptual idea of what the outcomes are going to be in a very positive way. And we've actually got a lot of research in the psychology world these days that says client expectations impact the outcomes of their treatment. And so the things like that, the client may have no idea what board certification is. But the fact that they see that on the wall in their treatment room or in the client's treatment room changes some things about their perception around what's going on with them. I'll tell you a funny little story about this. I was at a student who went through one of my training programs years ago, and this is back in like North Carolina or something like that. And I have a good friend that I went to high school with, and she wrote me a note And she said, I went to go get a massage from this woman, and I walked into her treatment room and I looked on the wall, and she had a certificate from the Academy of Clinical Massage with your name on it. And she said, all of a sudden, that changed her perception about what the session was going to be about. I mean, not probably in a dramatic way, but it impacted it.
Right.
Simply from that thing that was on the wall, because she knew I'd been doing all this clinical work for years.
Right.
Those things have an impact, and the client will never tell you that, because they're not going to say, like, hey, I saw you have this thing in here. This really makes me feel good about this treatment.
Yeah.
But it does have an impact, and it does affect them. So that's
Right.
something to think about a potential reason why you might want to go through and do something like the board certification, or, put your certificates on the wall from the training programs that you've completed, because
Right.
it, in fact, may make an unspoken difference with your clients.
Yeah, it puts an authority, I think, and I think you make a great point about that, because they're like, I'm trusting myself. One, people are coming into, with pain sometimes, and they're just like, they just want to get out of it, and now they're like, I'm going to be in good hands, and just that mental thought could make that difference to help facilitate that healing a little bit too.
Yeah.
So, I think that's a great idea to do that. And for another point to those, especially my students watching this later, is that's why the continuing education part, and there's a question just popped up on Facebook about that too, so I'll pop that up in a minute. But we tell them at graduation, do not wait until a month before you're supposed to renew to start to find out what the cheapest and the closest and the whatever CEs are, because you want to enhance your skills, and you want to dive into those populations that you want to work in, that especially right out of school, you're like, I'm going to do everything. I remember that for me. I was like, I bought hot phones, and I'm like, what am I thinking? I hate being hot. And like that, you don't have to be everything to everybody, but you start to learn that. And so the continuing education credit comment comes up, and what am I supposed to take? And that's kind of why I wanted to loop back into why I invited you on here today, because people are like, should I take this because I get credentials after my name? Why is it important that I do this? What should I take? And so the question that popped up here on Facebook, what's the point of having a certain amount of CEs every 2 years? At Arizona, we have to have 24 in 2 years. And I think most states have something around those lines, probably like 10 to 12-ish per year. And what is that simplified answer?
So the simplified answer to that is, it's an effort. It's a what am I trying to say? An initiative, or it's something that's trying to encourage people to focus on their education beyond entry level. So, for example, entry level education does a really good job of training people, I think, to be practitioners in that environment of wellness-oriented massage. This is, like the spa, the relaxation environment, the, cruise ships or wherever, just general relaxation massage. I think we do a pretty good job entry-level training of preparing people from that in that environment. We do not prepare people to be working with people who have compromised health conditions at the entry level. We just don't have enough training at that. And that's why majority of people get that training in continuing education courses. Now, if there was not a requirement to do continuing education, I'll tell you, most people wouldn't do it. And so, unfortunately, it has to be one of those carrot and stick things. And this is more about a stick. That is, we try to encourage people to do continuing education courses because you have to meet this requirement. Now, I'll also say this, unfortunately, what has occurred in the last number of years, and this is not only in our profession, it's happened in multiple professions, is, organizations come out with quick and easy ways to meet your CE requirements with very low budget, I'll be honest, crappy online courses, for example, that you can take and not even really pay attention to what's going on in the course. You can go, next door and watch Jerry Springer on TV and come back and take the quiz and pass it. And those are the courses that oftentimes, like you said, get done at the last minute because your education requirements are due for your licensure or whatever it is. And you could just go and you push and you rush that stuff through there. You're not going to significantly improve your professional skills and abilities by doing that. You will check the box and meet the requirements that you've done CE, but you're not really growing yourself professionally by doing that. The flip side of that is, and we have a lot of these students who come into our programs who are just like, well, I don't really care about the CE hours. They're kind of irrelevant because our program is 132 hours long. And so it's way more than anybody is ever going to need or be able to apply to their CE stuff. They're in it because they want to learn this stuff.
Right.
And so for those individuals, when you really decide that you want to learn something and pursue it, you can use those things for your CE credits, but that's probably not the main reason why you're in there and doing that.
Yeah.
No.
Yeah.
And I would also say, going back to something you said, Michelle, a moment ago too, is that, you know, when you're trying to decide what should I pursue and what should I look into after graduation, you know, think about what are those things that you're interested in and dip your toe into a bunch of different pools. Because, you know, when I got out of school, I was still oriented toward the idea that I was going to do some kind of mind-body approach to massage, where I was going to be doing some counseling and working with people with bodywork somehow or other. And it wasn't until, you know, a couple years later, after I'd taken, I think, a course in neuromuscular therapy and realized, like, hey, I really get into this stuff. I think it kind of like fits with me and who I am and what I'm really interested in a bit more than the other thing was. And sometimes you just won't know that until you try it. You may not have seen yourself doing this, but that's where you ended up, and that's what you ended up doing.
Yeah, absolutely. And so you make a good point with like the crappy classes. Like if you're taking those classes, there might not be a real point to it other than checking off the box for licensure. But if you're wanting to enhance your skills, of course, always great. Just keep getting more bodies under your hands and keep working and working. You always refine more that way. But until you really are taking more deeper dives into the body and understanding more, as I don't see how without continuing education. I run into people in the classes, people like don't remember where certain muscles are, and we're not talking very intricate tiny muscles. I'm talking like name the quadriceps kind of thing, and it's kind of like, oh my goodness, and you know, perhaps it doesn't affect their daily life and their clients, but I just feel if you understood what those muscles were and what you're doing, wouldn't your techniques and wouldn't your practice be more enhanced by it? But
well, and the other thing too is that, and you know, I did some work a number of years ago with one of the large massage franchises, and one of the things that came up was them talking about the perception out in the public and out in the massage profession that the people who worked at the franchises weren't that good and they gave crappy massages. And so, like, you know, don't go to so-and-so franchise because they give crappy massages. And like, one of the things I was bringing up to people is like, you know, it's actually not the franchise that's giving the massage, right? It's the individual that's there. So it's not the franchise that produces the crappy massage. If you're getting a crappy massage somewhere, it's because the person didn't get very good training. And so one of the things I like to emphasize with people is like, I don't care where you work. Let's say you work at a massage franchise or something like that, and you might think you don't need to know this kind of stuff until somebody comes in to get a massage and they have some kind of unusual condition that they mark off on their sign-in sheet, and you have no idea what this is. So it actually does make a difference that regardless of the environment that you think you might want to work in, this is what you can learn in continuing education that'll be really helpful for your professional development on down the road.
Yeah, absolutely. I've had someone on before. Her name is Jackie Sellers. She does oncology training, and Rebecca Sturgeon with Healwell as well, that does a lot of oncology. And we were talking about that. Like people are like, "Well, I don't want to work in with cancer patients. Not my thing, or whatever." But you know, I'm just going to work at a spa. It's like, do you know how many people are coming through a spa who have recovered from cancer or been touched by it in some way? And so it's not such a matter of just deciding for yourself. You don't always have control who's coming in on your table as well. So getting educated.
Because many of those individuals don't know that there are specialized things that massage therapists might need to know about what's going on with them. You know, you need to know that I have a circulatory problem. Why does that matter?
They don't want people don't want to fill out their intake form because I'm just getting a massage. You don't need to know any of my personal information. It's like, let's talk about that a little bit. Exactly.
Or the other one that we get a lot of times, like you're in the middle of a massage and you're doing something like, oh, you know, I forgot to mention to you that I have plates in my neck. Does that matter? You know, it's like when you're doing something. Just a little bit.
I know. I see this huge scar. It's like, what's this? You said no surgeries. Oh, well, I thought you meant like gallbladder or something. Like, no, that's just this. So like, education is really important. And I know another comment about the cost of continuing education and credentialing and other things like that. It does cost. There is some investment behind it, and I know sometimes that does lead to some challenges for particularly new students out the gate. But I like how you mentioned before about dipping your toes in. If you're looking at your course, it's 100. How many hours did you? 107?
132. Yeah.
32. I don't know where I got a 7, but sorry,
Yeah.
132. And that's my goal. Maybe I'm not doing it 3 months outside of graduating because I haven't saved up for that yet. But
yeah,
maybe I could take one, because I know you guys do have the shorter ones as well, right, on your website.
Yeah, well, our entire program is made up of 7 shorter body region courses, and each one of them are, right now they're, for example, on sale for less than $100, and they're fully online, so you're not incurring travel expenses, you're not incurring time away from work and all that kind of stuff. And this also gets in, and this is a whole nother ballgame about what makes really good education, because one of my pet peeves and what led me into exploring and looking into online education, this was back in the early 2000s, so this is almost 20 years ago. This was not just like cramming it in the pandemic 2 years ago, but this was 20 years ago, is that I was becoming incredibly frustrated with recognizing that it was extremely difficult to teach some of these facets of clinical reasoning and critical thinking skills in the standard 2-day weekend workshop format, where people are in class for 8 hours and they're mentally burnt after 3, and they can't take in all this content, all this compile it on. Because I would, teach something and, go through something and explain it really thoroughly. And I'd stop and say, does anybody have any questions? No questions. Okay, great.
Staring at
now
you
let's go do this clinical application activity. I'm going to give you this worksheet. I want you to go through it. And they would is this deer in the headlights look like? What do we do? You didn't tell us what to do. And that was the point, is that no, absolutely not, because this is the real world. This is what happens in the clinical environment. You have to be able to think through these things. And so I recognized that when education was being delivered in this fire hose method, it was really difficult for people to take it in and learn how to do more complex clinical reasoning. And so that's what led me into looking how to develop this stuff in online environments where we could work on much more interactive learning experiences that were unique to each individual. Because the other thing in the classroom is it's one pace fits all. It's the pace that I'm going at. That's the pace that we're doing things in the classroom. And if you're not, like, you don't have a great background in this stuff, you might take a little bit more time to get it. Or like if you're already an athletic trainer and you're learning this stuff, it's like I'm sitting around here twiddling my thumbs. Why can't I move on ahead? And so the online environment, if things are built well, and again, it's very difficult to build things well in that environment, but if they're built well, it's a really much more personalized learning experience for people. And I think it teaches a lot of these kinds of skills a lot more effectively. So there's a lot of different ways to do things out there. And most of the CE courses, I'll say this too, and this is kind of unfortunate, but the vast majority of the CE courses out there are really technique focused. They're mostly about teaching you techniques, and there's nothing wrong with learning new techniques. That's really beneficial. But I also would really encourage people to recognize that that's not all there is to it. There's really a lot more to a lot of these different facets. Like in our program, we spend a lot of time on kinesiology and biomechanics and treatment planning and pathology and understanding a lot of these different things that go into the clinical decision-making process. And again, these are things that are more difficult to teach in some of these kinds of intensive environments. But, there's a lot of different ways to do those kinds of things. And for me, it also allowed me to be able to work with people. Like I've got students all over the world right now, which I could never get to because I can only get to a certain number of geographical places to do things.
Yeah, that's great. And I just love, I know we never wanted COVID to happen, but a lot of things came out of being able to figure out how we can increase our resource. We have 4 campuses, so we have a really great instructor that, like, this is their jam, this modality that we can, disperse and get all the students to be able to do that and learn from. And I think that I don't know if it came out of it, but I know I've had Diane Matowski on this on my show, and Allison Denny with Rebel Massage and the Massage Mentor, and I know you're part of all the jams, right? That they do. So and is it the neck jam that's coming up?
Next jam's coming up next week. That's right.
So being able to have all these minds, what is it, like 12 or 14 of all of you, like talking about one body part? You want to talk a little bit about that?
Exactly. I mean, just take that as an example that the cost for bringing all of those instructors together to one geographic location to do something, for people to come listen to them and see them work and talk to them and all that kind of stuff, would be just exorbitant. It would just be out of the realm of possibility. But the online environment gives us the opportunity to be able to do that kind of thing. So that's a really good example of an innovative way to get people exposed to great education. And the great thing about those neck jam things is, like, I get to see a whole swath of very different approaches to things that are, quite different, but they're all focused on the neck or the shoulder or whatever that particular thing is. And I can see, like, well, I like the way that person works. I really connect with Judith Aston, or I, really love the way that Benny Vaughn does the sports massage stuff, or I really like, man, this is interesting structural things here. I want to learn more about that. So it's a great way to dip your toe in the water and see what kind of approaches resonate with you.
Right. Yeah. Because there's so many ways to do it. I love that. I think so far you guys have done the hip, the shoulder, now the neck, I think is the third one.
That's right. Yep. And I think she's going to plan to do, I think I heard her say the other day, she's going to do 1 a year now instead of 2 a year. So that's kind of good, because that, they come around fast, and like, that, a lot of people don't realize there's it's an hour-long presentation for us as presenters, but there's a whole lot of time that goes into producing the the video presentations and things that get done in there. So there's a lot that goes into it.
Yeah, absolutely. And the other ones, if anyone wants to follow, go to the massagementorinstitute.com, that you can find the information on the hip and the shoulder jam as well, and get there for at-home distance learning continuing education credits as well. So, and they're really, really affordable. And I love Allison and Diane. They're amazing, high energy. I was listening to your talk with Diane the other day about the value of success. And I just, oh my goodness, what a ball of energy that woman.
Yeah, she is. She really is.
I really love her.
Yeah, and she's done a wonderful job of pulling a lot of people together to do these things, and getting people direct access to a lot of kinds of stuff. So she's just done an outstanding job with that for sure.
Yeah, absolutely. Which reminds me to mention that you do have a wonderful podcast. Would you like to talk a little bit about that?
Yeah. So my podcast partner, Till Luca, who's a structural integration practitioner from many years, he and I both been in this. He's been in a little bit longer than I am. He's 37 years into it or something like that. So anyway, both of us aging veterans these days out here. But I wanted to start this podcast a couple of years ago of, we were Till and I were having some conversations about something, and I can't even remember what the topic was, but I was thinking like, man, this would be really interesting to share this discussion with people, because like we got into some really cool and interesting concepts here. And I began thinking about doing a podcast, and it's like, I want it to be a discussion between practitioners to talk about various different topics. And I thought, who would really be an ideal person that I would want to do this with? And, he was immediately on the top of my list of somebody that would want to do it. And luckily he said, he would jump in to do it. So we tackle all kinds of things from, injury conditions to, educational things to, just a wide, interviews with other, well-known individuals, just a really wide swath of things. And the podcast is called The Thinking Practitioner. And we love, hearing ideas and input from people of things that you want to hear us talk about or delve into. So it gives you some good insight on some of the things that are going on in the field for a number of years.
Yeah, make sure people get that up there so they can look. And I know I listen to it on Spotify, but pretty much anywhere you can get podcasts, you can catch it. And I think also on your website, you recap it as well, too.
We do. We put, both of us put transcripts up there for people who might want to be, look at reading it if they don't have, easy audio access or whatever. So that, as well as recordings of the podcast, can be accessed off of either of our websites as well.
Yeah, I love that. Awesome. Well, I hope I know every time someone says, do you know any massage podcasts? I'm like, let me tell you about one that I really, really enjoy. So and it's a wide variety of topics. So it's not even, if you're not really into the orthopedic clinical thinking, it's still a lot of things to hear about. And like that one with Diane was really great about the mindset behind what success really is. And I really enjoyed that one. Yeah. And that was soon after your birthday, I think. So
it was. I think it was. Yep, indeed. Yeah. And we learned so much from those things too. I mean, I one of the reasons that I wanted to continue doing it is like, I love talking with Till. He's brilliant. And the people that we get on there to talk about things are really, really brilliant as well. And they always bring new perspectives and new ideas and new ways for me to look at things. So, from a sort of selfish standpoint, I do it to learn more myself as well.
Yeah, I love it. That's one of the things really, and I said in the beginning when I don't know if it was before or after we went live, but one of the things we really love about listening to you and Till is about having just having I just want to need to learn more, and I need to question my own like beliefs and everything. And I just love hearing that. I love when a student comes out to me and said, wait a minute, you said this and that is what I'm like, all right, I see your point, and yes, I will look into it and talk to some other people and figure it out, because we're still always learning too. So yeah, I love that. So I know I try to keep this around an hour, and I could keep talking to you forever because I'm really enjoying this, but I also don't want to take a lot of your time. But I do want to ask those hot seat questions that I forgot to give you until just right before we went live. So hopefully
you know what, I just pulled up that email right before your thing, so I didn't really even get a chance to
all right, well, we'll
think about them. So I'll let them be true hot seat questions.
Okay. All right. So just to clarify for everybody, and to give one more last thing here. So your website where you can find all your great blog posts and the courses, and of course the link to your Thinking Practitioner podcast, Academy Clinical Massage. Again, that's a Thinking Practitioner. You can find on Spotify or wherever you listen to podcasts. And your article, the Future of Advanced Credentialing and Massage, can be found on the ABMP website from the Massage and Bodywork latest issue, the March-April issue, so everyone can check that out.
And that is available for free on their online.
I think you just have to put your email address in just to get access, but you can read the whole magazine for free there. So that's really, really great. All right, so hot seat questions.
All right, here we go.
Okay, so which talent or superpower would you most like to have?
I would like to be able to fly.
Yeah.
Just, now I don't like flying in airplanes, actually. Because we're not supposed to be flying. Every time I get in an airplane, I start thinking
this shouldn't be happening.
Physics of the weight of that thing traveling through the air. Like there's something that just doesn't fit right there. But I would like to be able to fly, knowing that I could do it the right way there. So my wife is involved with wild bird rehabilitation, so we spend a lot of time focusing on birds, and I've learned so much about them. They're just so incredibly fascinating. And so just watching what some of them do with flight things. I mean, some of the things that people don't really recognize and realize, like they're birds like the Arctic tern, I think it is, spends months in the air without landing during migration.
Whoa.
And it's just like, how on earth did they do that kind of stuff? And, they'll navigate from, the Arctic down to New Zealand or something like that and come back to the same place again later, in the next year or something. It's just absolutely remarkable. So I've become quite enamored and fascinated with those aspects of flight. So that'd be my superpower, I think.
I like it. It's the most popular response I've gotten, and it's a kind of a split between why people want to fly. One, they would like to just be somewhere else, be able to go wherever they want to, and some is the actual act of flying. So it's interesting to see the two different pieces. So
for sure,
I'm more on the teleporting side. I don't really need to be up there.
Right.
So if you weren't in the massage world, what occupation would you most like to have, or what do you think you might be doing differently?
If I didn't have to worry about making money, I would study earth science. I've always been fascinated by astrophysics and geology, and like how the planets came to be, and just ecosystems and things like that. Just the whole understanding more about this big thing, this big rock that we're sitting on here. So I'd really want to delve into that in much greater detail. And it's unfortunate, I recognize that scientists don't really make a good living a lot of times because they're so dependent on, grants and funding and things like that. So it'd have to be one of those instances where I had a benefactor, maybe. Just
just to learn and then teach us about it. I think you're onto something there, though, because you could explain it to other people better. So that would be.
Yeah, very.
I'll sign the petition for that one.
Okay, good. Yeah.
If money and circumstances were not issues, where would you most like to live in the world?
I would have to say probably the Canadian Rockies. I love that part of the world tremendously. My wife's from Alaska, and we used to live up in Alaska for a while, as I was mentioning, and we drive back and forth between those two places. And I loved living in Alaska. It was just wonderful. Both of us really have a connection, I think, with that part of the world on the way up there, just going through that place. It's so desolate, quiet, and undeveloped comparatively to a lot of other places, that I just love the closeness and the proximity of a real natural environment that's out there. So that would probably be my ideal kind of place.
Oh, that's awesome. I'll have to check that out.
For the winter.
Yeah. Well, and you get a nice cozy cabin and just enough food to last you the winter. You're good to go.
Yeah. Right.
What is your most treasured possession?
Let's see. If I think about that, I'd have to if it's my most treasured possession, it would probably come immediately to mind. And I would probably have to say, my father's a guitar and violin maker. And cool. I have a guitar that he made for me many years ago, and I never have learned to play it just because I haven't really had time. But it's a magnificent piece of artistry, and just because I know it was made with his hands, that's probably the thing that would fall as the greatest possession of mine. Yeah. Now I also have to say I have a lot of his work. I have 2 violins, a guitar, a bunch of birds that he carved, and all kinds of other things that he made because he was a fantastic craftsman. So they're all going to be on the top of the list.
Yeah.
So, that's and I actually have to think about that a lot because we live in an area, a very rural area of Oregon, and we have had a couple of instances in recent years where we had wildfires coming very close to our house, in which case we had to take that possession, throw it in the car, and leave because we were being evacuated. So it's a good question because you really need to be thinking about that.
That's what you're taking. You're taking it with you. Yeah. Good. Yeah. Make room for it. Got a box ready to go.
For sure.
Oh, I love that story though. That's so great. And last but certainly not least, what would you tell your 18-year-old self?
Finish your master's degree. One of them at least.
One, yeah. You had to pick one.
No, yeah, but I would say that the fact that I didn't finish either of those advanced degrees has kept a number of doors from being opened. Now, I have also been one of those individuals who, is kind of what I consider an independent scholar, which is I never let school get in the way of my education or the lack of school get in the way of my education. Yeah. But I also recognize I might have been able to carry the massage profession or move some things farther ahead had I finished and done, completed some of those degree programs that I was in. I would also say, however, that if I had to do it all over again, I'd do it exactly the same way because there were reasons I left them and there were reasons that I continued to do the educational things that were right after what they were doing. But I would recognize that later on down the road, do something and finish one of those things because it really would have allowed me to open some other doors for other people behind me as well that might not have been able to be opened that way.
What a great a philosophy on that. That's not for me, but for other people I love that.
Yeah, because there are you got to recognize that there's a lot of. I realized a number of years ago that I wasn't probably going to accomplish everything that I wanted to see happen in the massage profession before I, leave it and retire or something happens to me or whatever. But I will have been a stepping stone that hopefully helps other people, take it to a step farther and take that to a step farther and take that to a step farther. So that's what I hope to leave with everybody is some aspect of stepping stones that help them get to the places that they were. Because I certainly, learned so much and got to where I am because of the tremendous groundwork and footpaths that were led for me in front of me by some of the other wonderful people who've led the charge before I was here. So
and it's continuing. Trust me, we are definitely spreading it more and name dropping. And now I can say, hey, I know this guy.
All right.
Did this thing. So so we really, really appreciate all the work that you've been doing, and hopefully we all take it one step further as well and keep it going, keep the change.
All right. Sounds good.
Yeah.
Sounds good.
So I want to thank you so much for this time that you spent with us. And I got a lot of it. I think my students are going to really enjoy it. We got a lot of great questions that came up through Facebook and YouTube. So thanks everyone who's been watching live. Yeah. If you have further questions, you can always leave in the comments there. I'll make sure that we address them if you watched on the recap. But thank you, Whitney Lowe, for the time this afternoon. And
and I will also say, Michelle, to anybody, if you got other questions, if you want to ask me questions about stuff that I talked about or that we didn't get to, you can find me at Whitney at academyofclinicalmassage.com. Send me a note and I'll be happy to respond to those things as well. So that's Whitney at academyofclinicalmassage.com. So thanks everybody for the invitation to come chat with you all today and hope that's sparked some interest to look into some of these topics further a bit.
Yeah, I love it. Thank you so very much. And we'll see everybody hopefully next Friday for another wonderful live stream. Okay. Thanks, Whitney.
Thanks, Michelle.